Getting sick used to mean calling a doctor. Now it means checking your bank account. Today, treatment isn't the first step. It's navigating a maze of insurance networks, surprise bills, and figuring out if that sharp pain can wait until payday. For millions of Americans, getting sick means entering a financial minefield of deductibles, copays, and red tape. On today's episode of the Infographics Show, we're exploring why the U.S. can't afford to get sick anymore. It's 2050, and major U.S. cities have gleaming top-notch hospitals. Patients can get AI-powered scans that detect cancer when it's just a microscopic cluster of 4 cells. Surgeons use nanotechnology to eliminate it before it even has a chance to grow. 4 nurses are assigned to every patient, and after your operation, you recover on 1,000 thread count sheets in a room that feels more like a luxury hotel than a hospital. Well, you don't, unless you're a multi-millionaire or billionaire. More likely, you are on day 2 in an overcrowded emergency room waiting area calling your bank about a second mortgage just to cover the cost of treating a broken arm from a car accident. Assuming, of course, the internal bleeding doesn't get you first. So, how did we get here? It's no secret that the current healthcare system in the U.S. is far from ideal, leaving many people behind. Americans face worse healthcare outcomes than most of the world's other wealthy nations. They pay more for their bad outcomes, and they actually end up living less and less healthily. But things weren't always this way. Since the concept of managed care went into effect in 1973, leading to the rise of HMOs and the takeover of healthcare by for-profit insurance companies, healthcare costs have risen from $353 in 1970 to almost $14,600 in 2023. And if you're saying, hey, wait, what about inflation? You should know that $353 in 1970 is equivalent to just under $3,000 today. And that means healthcare costs for the average American have more than quadrupled since 1970. Considering managed care was supposed to limit and contain costs, it kinda seems like it failed miserably. And that leads us to the primary reason people are avoiding the doctor these days: cost. The U.S. pays more per capita in healthcare costs than any other country. Compared to other wealthy countries, it is an unbelievably enormous amount. The average amount rich countries spent on healthcare that same year was almost $7,400 per capita. In fact, the country that spends the second highest amount, Switzerland, spent around $5,000 less, at $9,700 per capita. And they have everyone else's money to burn. Well, maybe it's because the Americans are just getting amazing healthcare then. Well, not really. Americans aren't really living as long as people in other countries are. In 1980, life expectancy at birth in the U.S. versus similar countries was almost the same. The U.S. had a life expectancy of 78.4, while people in other rich countries lived to 82.5 on average. By 2022, U.S. lifespans had improved, but they were still nearly 5 years shorter than those in other wealthy countries. Life expectancy did go up slightly in 2023, suggesting COVID had hit the U.S. harder than most, but even then, it only reached 78.4 years, still trailing about 4 years behind the nation's peers. According to a 2021 report by the WHO, the average healthy life expectancy in the U.S. was just 63.9 years, nearly 15 years short of the overall lifespan. In other words, Americans can expect to spend a significant portion of their lives in poor health. And that means Americans can expect a lot of unhealthy years, needing a lot more, as you'll see, unaffordable healthcare. However, lifespans could also be influenced by things other than healthcare, for example, a diet of McDonald's and high rates of opiate use. So how does the U.S. healthcare system fare in direct outcomes? Not much better, and definitely not where it should be for the astronomical amount of money it spends on health. The Commonwealth Fund ranked 10 wealthy countries: Australia, the Netherlands, Germany, France, the UK, Canada, New Zealand, Sweden, Switzerland, and the U.S. on healthcare outcomes. And overall, out of 10 nations, the U.S. came in dead last. The good news? The country came in second on measure of care process, but when it comes to access to care and health outcomes, 10th. Measures of equity and administrative efficiency, 9th, which is better than last, I guess. If you think it was a close contest, think again. The chart depicting overall healthcare outcomes among the 10 countries isn't a descending line. It's a slightly downward sloping line for all the other countries, and then a cliff drop toward the U.S. The reports also found that the U.S. has the highest rates of preventable and treatable deaths for all ages. So how did the U.S. rank out of all countries in the world? The answer, according to the World Health Organization, is 37th out of 191 countries included in that year's study. And considering the majority of the countries in the world are classified as low income and middle income, and the U.S. is incredibly wealthy, that is not great. So what is the US spending all of its money on if not a better quality of care? The answer, which will come as no surprise to anyone who has lived in the US, is insurance. And we don't mean monthly payments to private health insurance, which are staggering on their own. We'll get to that later. We mean all the costs that come with having a borderline insane patchwork system of private insurance companies price gouging everything. Another report by the Commonwealth Fund found that 15% of excess cost of US healthcare can be chalked up to the administrative costs of insurance, and another 15% can be attributed to the costs of administrative activities in general. Dealing with insurance takes up a lot of doctors' and nurses' time that they could be spending taking care of patients. The same Commonwealth Fund study found that nurses and medical assistants spend 20.6 hours per physician per week on administrative tasks, nearly 10 times the time spent by Canadian practices. The main reason is obtaining prior authorization in the United States. So to save some time, they hire and rely on a bunch of administrative assistants, who then deal with the other administrators on the insurance side. So that, according to Physicians for a National Health Program, there are now 10 administrators for every physician in the US, and that rate is only increasing. Since 1970, the number of doctors in the US has gone up by 200%. In that same time frame, the number of administrators has risen by 3,800%. All of those administrators need salaries, and let's be honest, there isn't enough money in the world to pay someone whose job is arguing with insurance agents that cancer can't be cured with good vibes alone. Naturally, this drives up healthcare costs, and that's why administrative costs total 7.6% of the US's absurdly high healthcare spending, but only 3.8% of healthcare spending in comparable countries. This comes out to around $925 per person in the US for administrative spending compared to $245 per person in other countries, a difference of $680. As former Commonwealth Fund President Karen Davis says, the US spends nearly twice as much per person on healthcare as any other country, and high administrative costs due to our inefficient insurance system are a contributing factor. However, insurance isn't the only culprit. Americans pay way more for prescription drugs than other people around the world, about twice as much per person. Weirdly, prices for generic drugs in the US aren't that bad. Prescription drugs are the ones that break the bank. Since 80% of pharmaceutical spending in the US goes toward prescription drugs, overall medication costs remain sky high, averaging $1,600 per person in 2021 compared to just $944 per capita in other countries. All that being said, the biggest difference in healthcare spending remains in inpatient and outpatient care. Americans spend on average $7,500 per person, while comparable countries spend just under $3,000 per person. And it's not because Americans are using healthcare more often. Patients in the US actually have shorter average hospital stays and fewer physician visits per capita. This also isn't because the average American is healthier, far from it, but because they're usually too scared of going broke to go to the doctor unless it's a real emergency, and sometimes not even then. According to a report titled Closing the Primary Care Gap released by National Association of Community Health Centers, nearly a third of Americans lack access to primary care, and about a quarter of those are children. That's more than 100 million people in the country. And that is a real problem. If you don't have consistently recorded medical history, when you do end up seeing the doctor, there's no real way to check what indicators and blood levels are normal for you. Not to mention, having a reliable GP who knows you well improves healthcare outcomes. One study found that people who had fewer to no visits with a primary care doctor experienced more emergency department visits, more hospitalizations, and higher costs. People who didn't see a GP regularly experienced 1.7 emergency department visits per year, compared to 1.31 for those who did. They also had 0.69 hospitalizations, compared to 0.57 for people who reliably saw their GP. Someone who sees you on a regular basis is better able to detect changes in your physical health, your appearance, and even your mental health than a doctor who has never met you before. Not to mention, one of the most important things you can do in terms of preventative healthcare is regularly see your doctor. So how many Americans are avoiding their doctors? Well, one Gallup poll conducted in 2022 found that 38% of U.S. respondents skipped or delayed medical care, with most of them pointing to cost as the primary factor. But it's not the only factor. For a lot of people in the U.S., finding a doctor to see in a timely manner in the first place is almost impossible. The number of practicing physicians per capita in the U.S. has been growing very slowly during the 21st century, at a rate of about 14% compared to the OECD average of 34%. According to the Association of American Medical Colleges, AAMC, the U.S. has an average of 252 direct patient care physicians per 100,000 people. But even the difference between those two numbers doesn't tell the full story of the U.S. doctor shortage. Doctors in the U.S. are heavily skewed toward higher-paid specialists, rather than GPs and family doctors. Only 12% of physicians in the U.S. are generalists. In comparison, 37% of the doctors in the UK and 45% in France are generalists. That creates an even bigger shortage of doctors, as most people feeling sick want to see a generalist, not a plastic surgeon or an otolaryngologist. And even if they can find one, well, they'll have to check if their insurance covers them, and what their copay is, and wait, do they even have insurance? Because they may be one of the 26 million Americans who don't, around 8% of the population, or almost the entire population of Australia. In addition to those who lack any insurance, the Biennial Health Insurance Survey found that in 2024, 12% of Americans had a gap in coverage within the previous year. Another 23% were underinsured, meaning though they had insurance, it wasn't enough to give them affordable access to healthcare. That's a problem because 69% of uninsured adults avoided going to a doctor, while 57% of underinsured adults said they avoided necessary healthcare because the cost was too high. That's compared to 36% of the overall U.S. population who said they avoided seeing a doctor in the last 12 months because of how much it would cost. In fact, 41% of people who said they delayed care because of cost went on to say their health problem had become worse because of the delay. Underinsured adults who did seek care had another big problem. 44% had racked up medical or dental debt, with 48% of those with debt saying that they owe more than $2,000, though that pales to all the numbers on medical debt we'll get to at the end. Many Americans are being forced to choose between taking care of their health and racking up medical debt, or letting their health go but remaining financially stable, at least for now. Putting off care might seem like saving money, but an emergency room visit or a hospital stay later on is almost always far more expensive than seeing a doctor early. That is, if people even go at all. In 2023, Civic Science found that 28% of adults in the U.S. said they or someone in their household avoided going to the emergency room in the last 12 months, and this was because they were afraid of how much it would cost. But let's say that you have some good insurance, and you want to go visit a doctor, preferably one covered by said insurance. That might be an issue since the U.S. Government Accountability Office found the majority of insurance companies whose medical or dental plans were reviewed by federal regulators failed to meet network adequacy standards. Network adequacy standards mandate that a certain number of doctors within a reasonable distance from where you live have to be covered by your insurance. Since specifications for what adequate means are vague, many insurance companies ignore this rule, meaning you might only find a handful of doctors covered by your insurance in your area, and when you do, they're going to have another 5,000 patients trying to see them as well. As Tracy McMillan, president of Marketplace Insurance Exchange, says, you might face a 4 to 5 month wait to see a primary care doctor, and that's all because of shortages of physicians in general, and in-network physicians specifically. But let's say you found a doctor and they're willing to take you on, so you go in for your first visit. An average primary care doctor visit costs between $150 and $300 without insurance. So you see the doctor, and they decide to run some blood tests so they can see what's going on with you. And since you are covered for this medical visit, you'll just pay the copay, typically between $10 and $25 per visit. Except the blood tests were sent to an out-of-network lab, and suddenly you see a bill for $800. Now, the No Surprises Act, passed in late 2020, may protect you with some emergency out-of-network costs, but it may not cover this. And before that law, patients in doctors' offices and ERs fell into the out-of-network traps all the time. This happens when a patient goes to an in-network office or hospital, but their scans, tests, or referrals are sent to out-of-network providers without the patient being informed. So suddenly, instead of a $25 copay or deductible, you're on the hook for thousands of dollars without even knowing why. Back to your increasingly annoying doctor's visits. The next day, your primary care doctor calls and says he wants you to go to a specialist. Their visits cost over $250 on average and are much less likely to be eligible for copays. But this one is covered by your insurance after you meet your deductible of $3,000. A deductible is the amount of money you have to pay before the insurance company will kick in to actually cover the covered services you might use. The average deductible varies from plan to plan, so it's almost impossible to come up with an average amount, but usually it's at least a couple $1,000s. Unless you have a chronic illness, get hospitalized, or constantly catch bugs from your toddler, chances are you won't hit your full deductible by the year's end. So the health insurance you pay an average of $8,900 a year for isn't actually covering much, not until you pay even more out of pocket. Oh, do you have a family? Well, the average family policy costs $25,600. Of course, if you have an employer that pays for 100% of your health insurance, that's great. Most employees do pay a small but significant percentage for their premiums, and self-employed people are completely screwed. But let's say you found a health insurance plan online with much lower premiums. It's actually the first sponsored result at the top. How has no one else found this great deal? Probably because you've just found one of the many junk health insurance plans. These plans provide absolutely terrible coverage that doesn't have to comply with the Affordable Care Act standards. Often, they won't cover prescriptions, specialists, hospital stays, mental health treatment, maternity care, or honestly, almost anything. And in case something medically catastrophic happens to you and you end up in the hospital, junk plans usually limit how much they'll pay out, so you are screwed either way. Sam Blokel found this out the hard way after he had purchased what seemed like an affordable plan, actually a bundle of 4 short-term plans to cover emergencies. Just a month later, he was diagnosed with stage 4 non-Hodgkin's lymphoma, and he learned that his insurance plan wouldn't pay for his treatment. Corey Dowd was hit with similarly bad news after he found a short-term plan for $100 a month with reasonable copays and coverage of up to $1 million in claims. Then he found out he needed an emergency appendectomy, one that he assumed was covered by his insurance. His first inclination that something might be wrong was when he was hit with a $41,000 hospital bill. Dowd went back to his plan and scoured all the fine print, and there, in almost illegibly small script, he found it. His plan would only cover usual and customary charges not to exceed $2,500 per surgery. And considering that almost every U.S. surgery costs a crazy amount more than that, the junk health insurance company clearly knew they were leaving their customers with the bill. Anyway, back to the specialist visit. Bad news, you have diabetes. Worse news, you have diabetes in the U.S. Almost every medicine is at least twice as expensive in the U.S. as in other countries, but insulin in particular is expensive. A single vial costs an average of $98, with prices for insulin skyrocketing above $300 in some areas. The country with the second most expensive insulin in the world, Japan, offers that same vial for $14.40, almost 6 times less than the US average. Considering diabetics need multiple vials per month, that'll often lead to out-of-pocket costs that amount to over $1,000 per month, sometimes even with insurance. And that is something that Sarah Skipper of Indianapolis found out the hard way. Human Rights Watch, a website no country really wants to be mentioned on, interviewed Skipper, who said her job's health insurance didn't cover her insulin needs. Since she and her sister both have diabetes, they were sharing insulin to keep themselves alive. One day, her sister took less than her dose to make sure that there was enough insulin left for both of them. The next day, she went into diabetic ketoacidosis and had to be hospitalized for 4 days. Skipper says she almost went into a diabetic coma, a situation that could have easily resulted in death. And Skipper and her sister are far from the only ones to do so. According to the Annals of Internal Medicine, around 1.3 million diabetics, or 16.5% of all insulin users, have to ration their insulin because of cost. Not only does this result in worse symptoms and side effects, but a handful of diabetics actually end up dying every year because of rationing. The problem goes way beyond insulin as well. The CDC found that 8% of people aged 18 to 64 who took prescription medication tried to save money by skipping doses or taking less than they should. Obviously, skipping doctor's visits, not taking medications correctly, and avoiding care to save you money usually leads to your health problems getting worse and fast. So now, you've ended up in the emergency room and the average visit costs around $3,000, though it could vary between a few hundred and $20,000 depending on where you are and what your problem is, and you're going to have to stay in the hospital for a while. The average cost for a one-day stay was $3,000 in 2022, though again, this could vary a lot, which adds a whole lot of fun unpredictability and lack of transparency to your life while your health is falling apart. You better hope that you don't need surgery, because according to the 2023 Milliman Health Cost Guidelines, surgeries cost between $4,000 and $200,000 without insurance, with ultra-tricky surgeries like heart transplants costing more than $1 million. No wonder Americans are racking up medical debt to the tune of $220 billion, according to the Survey for Income and Program Participation, or SIPP. The same survey found that 1 in 12 U.S. adults, or 20 million people, owe medical debt over $250, and that is just those who formally owe the debt. Another poll by KFF found that if the definition is expanded to debt owed on credit cards or to family members, 41% of U.S. adults have healthcare debt, 6% of adults owe over $1,000, and 1% of adults owe over $10,000. Considering 62% of Americans told Lending Club they live paycheck to paycheck, owing these amounts is clearly financially problematic for most people. Not to mention, delaying care and not taking medication leads to more of these mega expensive hospital stays and surgeries, and that makes the healthcare system overall even more expensive and unaffordable, which leads to more delayed or skipped care, and on it goes. The problem with Americans unable to afford getting sick is that it isn't the exception anymore, it's the norm. This wasn't the case a few decades ago, but healthcare has continued to become less and less accessible and less affordable for the average American over the years, with no course correction in sight. Unless something changes, the US may become a country where the cost of getting better is more dangerous than the illness itself, so people may end up literally choosing to get sick and possibly die. If navigating the US healthcare system doesn't kill you, something else eventually will, so you might want to know what happens to your body after you die. Or click on this video instead.